The next one we're going to do is unconscious oral care. That means someone's not awake, they cannot have liquids down their throat. You have to be very, very careful when you're doing that. People that are unconscious need oral care quite often, so we're going to demonstrate that now. Hi Melissa, I can see that you're not talking to me, but I'm Amy, I'm your certified nurse aide. I'm going to do unconscious oral care right now, okay? So I'm going to go wash my hands, gather my equipment, and I'll be right back. As you can tell, the resident is not talking or moving at this point, so we're just going to go ahead and do the care. Get your hands washed. Water just needs to be of tepid temperature, which is just lukewarm. To gather your supplies, you're going to need a pair of gloves, water. You may choose to use water, or you may flavor it with a little bit of mouthwash, usually just a little bit. Just turn it very light green. Go ahead and put your gloves on. If you drop one, just leave it on the floor. You can pick it up on your way back. You're going to need at least one toothpick, but you might want to take a couple extras just in case if the mouth has a lot of mucous membranes or sloughing of the tissue off. You're going to take this. You're going to need something to cover the resident up, and you're going to need a paper towel for a workstation. Knock, knock, Melissa, it's Amy again. I'm going to shut the curtain. To open these, just push the sucker stick right through there and pull. We're not going to be putting liquid in their mouth, so there is not a problem of liquids going down to their throat into their lungs, which is called aspiration. What we're going to do is moisten it. We now are going to get rid of all the liquids. Okay. And we're going to go in there and clean the resident's mouth out. I'm kind of doing a twirly, a little bit better, because I'm looking for any sloughing or mucus that might be built up. Looks pretty good. Getting those oral buckles. Hitting the teeth to make sure there's not any buildup. I'm hitting the inside. It's doing good. If you need to re-moisten it, you're more than welcome to. If they clamp down on it, you just wait for a minute, wait for them to relax, and then continue. Hit their teeth and hit the upper part of their mouth, and then hit their tongue. Again, you're looking to see if there's any debris or anything that you need to. The other part you may, when you're taking care of somebody that is unconscious and a mouth breather, we might have some Vaseline and put a little bit of Vaseline at this time right around their lips. Okay, make sure their mouth is nice and clean. And then just take care of your area. We're gonna put this in the hamper. Then that's that little pink thing. We're gonna put this, now we can pick this up. We're gonna empty the water. Dirty to dirty, clean to clean. And washing your hands again. Always remember, no liquids down their throat when we're doing unconscious care. You could cause someone to aspirate, which means the liquids go from their mouth and skid down their esophagus into their stomach. They would go in their trachea down to their lungs, and that could become aspiration pneumonia, and people die from that. So you want to be very, very cautious about not putting liquids down someone's throat. Okay, that concludes unconscious care.